Hi everyone, this is Dr. Raquel Butler from Integrated Veterinary Therapeutics.
And Sophie Vandenberg from Equine Postulate. And we welcome you to the Equine Functional Posture Podcast, your ultimate source for insights into the influence of functional posture on biomechanics, health, and overall well-being of horses.
Whether you're a seasoned equestrian, an equine professional, or simply a horse enthusiast, this podcast is designed to help you understand the critical aspects of functional posture.
Tune in each week as we discuss practical tips, delve into expert interviews, and explore the latest research in the impact of functional posture on equine anatomy, physiology, movement, and more.
Let's create a world where we empower our horses to be in a mental, emotional, and physical balance. So welcome to this episode. Today we're talking about gastric ulcers. So how are you today, Sophie?
Hi, Raquel. I'm really well. Looking forward to today's discussion. There's a little bit to equine ulcers and they're linked to posture. There's lots of things to consider. How would you describe equine ulcers?
Yeah, well, there's like equine gastric ulcer syndrome. It's generally referred to now, and like there's different types of ulcers in the stomach depending on where they influence the stomach. So we've got stomach ulcers and hindgut ulcers. And in the stomach, there's a glandular portion of the stomach and a non-glandular portion of the stomach. So, there's a portion of the stomach that holds the food and releases the acid to digest the food. And then there's the non-kind of acid area that's protected. And sometimes the acid splashes up into that area and it creates like sores and ulcers and disrupts the natural protection mechanisms, the natural mucus of the stomach. And so I've seen a lot of ulcers under dissection in the stomach. I've seen a lot of, especially along the junction, which is called the margo plicatus, of the glandular and non-glandular portion. I've seen a lot of chronic ulceration where the ulcers have healed, but it hasn't returned to like healthy integrity of the stomach. Like you've got this chronic thickening of the mucosa in there. And so it's not going to be acting like healthy mucosa. Like it's not going to have the same production of all the protective mechanisms. So that type of stomach is going to be more prone to damage. And then I've seen stomachs that have what I would call a gastritis, where it's like a general inflammation through that the acid producing area, where it's like all just red and inflamed and it looks so sore.
Right. Yep.
And then the hindgut aspect of it, like under dissection, again, seeing some really unhappy hindguts where they're red, they're inflamed, they're thin, they are it's generally like a more diverse lot of inflammation. So the stomach and the hindgut, like they have quite different functions. And so
Right.
we've got that.
Yes. And so when you're talking about the hindgut ulcers versus the foregut ulcers, what is the difference? There's a acid versus microbial balance, but can you elaborate?
Yeah, so the stomach is designed to continuously produce acid, like hydrochloric acid. Unlike ours, we produce acid, in relation to a meal, in response to like seeing a meal, eating a meal. Horses are constantly producing stomach acid. So regardless of whether they're eating or not eating, they're still producing acid. And their stomach is designed to handle that generally because they're also designed to be eating.
Yep.
Reasonably continuously. They're not designed to go for long periods without food. So that's kind of your acid production within the stomach. And then in terms of the hindgut, there's a microbial balance in the hindgut where we have all these like good microbes, which are not just bacteria, like it's bacteria, protozoa, spirochetes, I think. Like there's quite a number of different microbes that are in the hindgut, and it's actually different for every individual horse a little bit. But they break down the fiber, so and produce volatile fatty acids, which are really important for energy production in the horse and lots of health aspects. And so, you know, when that microbial balance gets thrown out in the hindgut, which can be from a change of feed, especially when the grass comes in, that will completely throw out that microbial balance. Stress, like we're going to talk about that, but that microbial balance doesn't just fix itself. It can take months to get that back to a healthy flora again. And when that flora is not healthy, the pH of the hindgut is a bit more alkalytic. So the stomach is very acid and the hindgut is not acid. And so when that pH of the hindgut changes, the microbes die. They don't like it. They like it to be very stable pH in that hindgut. So, you know, that's kind of a bit of an overview of the stomach and the hindgut, or foregut and hindgut.
Yep. And as a general, you know, why we're talking about this is because there is a relationship to the health and welfare of the horse and the effect on the rider. And we're going to go further into, you know, how we would link that to posture as a main system. If you were talking to someone who is suspicious and they wanted a diagnosis about their ulcers, what would you tell them about?
Yeah, so I think the important thing, and we're going to talk about signs and, you know, the signs that you might notice that lead you to wanting a diagnosis. But, you know, number one thing is to have the horse scope, so an endoscope, pass down the esophagus to look at the stomach. And so that's number one. And, you know, if you've just bought a horse, you probably should do that as a routine thing when you get it home, because there's lots of potential reasons why that horse could have ulcers, or if you just got a thoroughbred off the track, definitely. But it also gives you a baseline of damage in the horse's stomach. So if you get a horse, you just bought a new horse, or you've moved the horse or anything like that, I would, you know, be worth getting a scope done.
Yep.
So that's going to tell you about stomach ulcers. The challenging one is the hindgut, because we can't scope it. We don't really have a way to effectively image it. There is a test called the Succeed Fecal test, which tests the it basically tests for either fresh blood or digested blood in the feces. So it's looking at albumin levels, but if you're going to get a different result. If there's fresh blood, it's more indicative of hindgut. And if there's digested blood, it's more indicative of stomach, but they're looking at a component of that within that test. No, you know, it's not entirely accurate. So you can get false negatives and false positives, but it's one option, and it's not the cheapest option, and the vet's got to have it on hand. Not all vets have it on hand, but that's an option. And we'll talk about other signs of hindgut dysfunction as well. But I think if you've got stomach ulcers, you probably should be looking at hindgut health and function anyway.
Yes, of course. And what you were saying about there are signs before you even need to have a diagnosis, what are some of those things that people can observe in their horses?
Yeah, so just looking at their standing posture, like, and again, it's one of those things where we're adding up the puzzle pieces, right? It's like if they just have one sign, there's like a million things that one sign could be, but we're adding up the signs to go, hang on, they've got like all, you know, a number of signs which are pointing towards ulcers. So one of the things are like they might stand more base narrow, so with their feet closer together, so it's a bit more of a protective stance on their like organs. They might have undesirable angles on their back feet. So, you know, a really steep coronet band angle that when you look at that angle, like it's going up towards the elbow or the stomach, like it's what you would call a negative plantar angle. And they could also have like crushed heels in the hinds as well. In the front feet, you might see they have like a bit of dishing in their toes or be quite upright in their front feet. And I think that when you think about this actually from a fascial perspective, and we haven't really gone into like the myofascial lines, but when you think about the myofascial lines and how they interact with the organs, you can kind of understand the pull on the body that creates some of these standing postures, and why we get the changes in the feet, because a lot of these fascial lines are connected to the feet.
Yeah.
That go through they incorporate the organs.
Yeah,
So
absolutely. There's so much influence there. And sometimes it's easy, to forget that there's that connection between the outside and the inside of the body, but it's a constant influence and there's just so much to consider. If you were thinking about more of the superficial tissues, such as, the outside of the body, what are the areas that would, scream that we should be looking further?
yeah, I think for me, when I'm looking at a horse from a bodywork perspective, if I start assessing them and they're reacting to everything I'm assessing, then I'm straight away thinking, this horse is very reactive. Do they have ulcers? So, so I did a course with Dr. Kerry Ridgway years and years ago now. Unfortunately, he's deceased, but he's an integrative veterinarian. And he, talked to us about the patterns in the body that occur related to ulcers that he'd recognized from an acupuncturist Chinese medicine perspective, a myofascial perspective, and a chiropractic perspective. And so I use his points to check for reactiveness. And so the areas that they'll be really reactive, like in the wither pockets,
Yep.
in the girth and the pecs. So like they'll, want to bite you, or just you'll see like a lot of tremoring and twitching. In the thoracolumbar area, which is the junction between like the rib cage and the lumbar. So they'll often be quite sore, so back of the saddle type area. The sacroiliac joint, like you could drop them when you palpate through there. And I have had horses where they've cleared up the stomach ulcers, and so they're not reacting, from a stomach perspective, but they're super reactive still through a lot of the hind end points. And at that point, I'll treat them and they're not responding appropriately to my treatment. And so then I'm like, maybe this hind gut is still a problem. And then we've treated the hind gut and then the sensitivity has gone away. And they'll also be quite sore in their jaw, because there's a jaw connection to, again, those ventral fascial lines. There's quite a lot of connection into the jaw.
And sometimes often horses with ulcers will grind their teeth as well. So that connection into the jaw and the tension through the neck and the brachiocephalic, which is mentioned in Kerry's course as well, is also another indicator.
Yeah, so down the front of that brachiocephalic. And teeth grinding, like there's other pain signs, obviously, like teeth grinding, persistent yawning. Like if your horse yawns a lot, that can be a sign of pain and ulcers. And just generally cranky, and they can become quite aggressive. So, they can have, like they biting ears back. Like I had a child's pony last week who, just started to get real cranky with the kids. And I said, oh, you need to go get it scoped and then I'll see it in a couple of weeks, because it's better if I treat it after they've got it comfortable. And sure enough, he had like a big, like probably a 20 cent size severe ulcer in one spot for whatever reason. Like maybe it was stalky. Like it looked so painful. So as soon as they started him on medication, like he just whole demeanor changed. So he, whenever you got a cranky pony, there's usually a reason for the cranky pony.
Absolutely. And it's not just the crankiness that can be affected, because if you're seeing things show up in the body as painful areas, the motion of the horse is also going to change. Everything from a loss of performance, refusing jumps, bucking, reluctance to go downhill, especially endurance horses. Would you elaborate on that?
Yeah, so I think what happens with that is, well, not I think, like what happens with that is that the acid, like if it's splashing up into the areas that are inflamed, like you just imagine that. It's like you've got an ulcer, or it's kind of like, when you've got a cut on your hand and you get some salt in the wound or something and it stings. It's like that acid is sloshing around in there and going up into those inflamed, unhappy areas. And so jumping is a big one, obviously, because there's a lot of movement. And so as the movement, but as they come down, like it could just slosh up. And the same with the going downhill, like the acids moving into that area. And then changing into like the canter. The canter is much more forward and back type of movement. So you can just imagine that fluid in the stomach just sloshing around.
Absolutely.
So any movement there's a lot of, rocking motion in the horse, like pirouettes, like a rollback where there's a sudden change of motion. Anything that's, if you think about riding along holding a glass, anything that's going to make that water slosh more is probably going to make the gut fluid slosh around more and cause a lot more pain.
Definitely. And we'll talk more about what you can do for that in our, to manage helping with those issues. And when you're not riding, you can also see that there are other things that show up. The horse might have a reluctance to be groomed, or they'll show the behaviors you were talking about, like being reactive, ears back, a pinched face, or turning around to bite you, especially when you go to do up the girth or to put the saddle on. Their coat might be dull, or they have hoof quality issues, having their feet handle where they've got to shift their weight and use their thoracic sling differently, the connections you're talking about to the myofascial area, and of course the stomach is sitting just inside from, back from where you would put the girth. There's a lot of tension there and influence that the horse is going to feel through the rib cage as it shifts. All the organs are suspended from within that cavity as well. So as you influence that, they're going to really feel it. You can have fecal changes as well. Disruption of the microbiome back there is going to influence the intestine, how much water is being pulled out of the poo, as well as an irritated gut will evacuate faster with less thorough digestion as well. And that can have an influence on a horse's ability to gain weight as well.
Yeah, and we've just got to be careful with that one too, because, people look at the weight aspect and go, well, the horse doesn't look like it's got ulcers because, it's well-rounded and it's, it's holding its weight fine. But you can have horses that look, so like you mentioned coat and things like, and hoof quality and stuff like that, but like you can have horses who look fine in the coat, their weight looks fine, but they've still got ulcers. So that's where yes, you look for the signs, but if they don't fit the whole picture, it doesn't mean that they don't have them.
Right.
Because, I've seen horses that are pretty healthy looking that have got a positive ulcer diagnosis.
Absolutely.
Yeah. So then when we think about like some contributing factors, there's a lot for horses, that this is why it's so common. Like, I think it's, what is it, like, it was pretty high. It's pretty high in race horses, the number, like it was over 90%. I'm hoping that's decreased now with better knowledge and management, but it was very high in thoroughbreds for a long time. And performance horses, I think it's sitting, the last study I read, it was like 65% in performance horses. So, it's very prevalent in our horse population. So what kind of contributing factors, are you aware of?
So there are multiple factors, and for different reasons. Some of the biggest ones are stress and stress on the body, and for different reasons.
Well, they're all really stressed, aren't they?
They really are all a form of a form of stress on the body, and whether that's because of an emotional issue or because it's an environmental contributing factor that is management based, so the horse isn't having their needs met for their species, dietary or management needs. So one of those might be isolation. It's quite stressful for a horse to be isolated. That stress increases cortisol and increases gastric acid secretions as well. You can have, things like training that are going to influence the horse. What kind of movement are they doing? We were talking about the movements earlier that are going to, swish around that acidic juices up onto the stomach that can be painful. It can be a causative factor, and it can also be a maintaining factor for ulcers. Another one to consider is transport. Transport is a time when horses have their head up. They don't have their head down. They're not grazing, so they're not having that continuous intake of forage that buffers the stomach and protects against the splashing. And it's also a stressful event. So again, you have the cortisol, and you also have a mild decrease in your immune response when you're under stress as well. So those are some factors. What else is there?
I think, yeah, we've got to consider any medication. So like if your horse has been on bute, especially if your horse has been on bute and there's other associated stress, such as like the travel or the isolation or, some other change in their environment that they're not coping with, and they've been on bute, or say they've got laminitis or some other metabolic issue and they've been on bute. So non-steroidal anti-inflammatories are, like, there's studies to show that you'll get gastric ulceration related to them, and it disrupts the flora, and it actually, they're not selective for inflammatory markers, like, so that actually can be blocking healthy factors that the body needs, for lots of function. So we have to remember that when we've got our horses on non-steroidals. Joint injections, especially if, they're having cortisone joint injections and they're having them regularly, like you've got to just think about the effect of that on the whole system. And just withholding food. So I don't think withholding food is the primary cause, unless it's a long-term withholding of food. I think it's withholding food with stress that causes the problem, so like they say, more than 4 to 8 hours between meals, horses shouldn't go for that. Like, but I think if the horse is not stressed, you can get away with that a little bit more than a horse that's stressed and not having food. So, for example, my horses overnight will go a bit longer than 6 hours sometimes, but they're not stressed. But if I took them to a different place, then I could set them up for ulcers, because of that. So that's really important. And competition, I think, did you say competitions?
I didn't.
Yeah, so like just the stress of going to a competition, like some horses have a lot of anxiety associated with that. It might change their routine, their feeding routine, their drinking routine. So like dehydration could also lead to ulceration, like if they're not drinking. So they're probably all big ones. Yeah, there's also another group of horses that are pretty susceptible, but that we don't always think about, that you work
Yeah.
with.
Yeah, our babies, they I think there's so many things to consider there, because they are a young nervous system, so they're really, really susceptible to stress. And there are so many factors that they go through in the first year of their life, including being born. They can be born with ulcers. That's been seen in dissection, I believe.
Yeah, well, and I've seen a couple of foals that just really displayed obvious ulcer signs, and they were both two in particular who, like, they were angry little foals, and they were born from laminitic mares. So
Right.
a lot of stress in utero and just high cortisol levels. Those mares that had periods of time on bute. And so a foal that's born out of a stressed mare is not necessarily going to have a healthy kind of gut system.
Yeah, absolutely. And there's so many things that, they're still drinking mum's milk. So they are also susceptible to, stress in her body, cortisol levels, medication that she is
Gotta be.
exposed to afterwards. And you have situations where, mares can have sickness post-birthing where it's from retained placentas and different things that can affect the foal as well. There's also often a period where the mare begins cycling again in the week after she's given birth, and foals will often have a period of intestinal upset while her hormones are changing, and you can see that through the milk. So that's another event they go through when they're weaned. Studies have been done on foals primarily for box weaning, but the sudden interrupt from mum and a change in diet that doesn't include milk anymore, and going on to some other kind of food and then adapting to grass, forage, grains, etc. It's really hard on their little tummy. It's a big deal. And then they also go through a process in their first year of being introduced to people and learning, and that's a really big stressor, I think. I think it's a really major thing because we take it for granted, older horses, who we meet along the way, and they've been exposed to so many things, but everything that a foal experiences in their first year is so often new. It would be like coming across something brand new every day. Today I had to learn, and tomorrow I have to experience something new, and then I'm learning about the farrier and all these things that are so that are forms of stress when you experience them the first few times. And we try and minimize them, but they're still going to have an effect.
Yeah, that's why, it's really important to become aware of low stress weaning and how to do that, how to do gradual weaning. Like there's studies now showing the benefits of that. And creep feeding where you make sure that they're, basically on the diet that they're going to go on after weaning. So like you try to eliminate some of those stresses. The other thing I just wanted to mention too is that the way that foals establish their gut flora is through eating the mare's feces or other horses' feces. So if your foal, is only exposed to your mare's feces as opposed to a foal who's in a herd where they're exposed to, a number of different horses, that could also influence, how that gut flora develops, because every horse has a different balance of those gut flora, and so the health of the horse's feces that they're eating is actually super important in that development of that flora too.
Of course, yeah, diversity and the quality of the microbes that they have there, of course. And there's another big group that can sometimes have an effect on the intestines, which is worms. You can have bots in the stomach, bot worms. They're little grubs that erupt from, they bury into the gums, and when they erupt, they travel down into the stomach and attach onto the lining of the stomach. And I've been in dissections with you where the stomach was really ulcerated with populations of bot worms. And it looked very irritated and angry, and that would have been uncomfortable.
And we also have to consider that when we worm them to kill the bots, and say because those bots attach to the stomach lining, like you said, and then when we worm them and they detach, there's potentially a really susceptible time there because they often have destroyed the mucosa, and so you've basically could have a period of time where you've got just ulcers from the bots detaching. So yeah, horses that have had a bot infestation, like I've felt under dissection some horrible thickened yucky stomachs with chronic scarring from bot infestation. So
Yeah, that's yeah. And there's better information now on understanding, because bots don't show up in your fecal testing for worms, that you need to be mindful about when you're going to do a bot worming, because it needs to be at the end of the cycles. Otherwise, you're going to have a reoccurrence, and trying to get the most out of, a worming cycle for your bots.
Yeah, and I recommend that you find somebody who talks about that because yeah, it's different to worming for the other worms. So be really familiar around timing of worming for different worms.
Yes, of course. And there's worms that affect the hindgut as well. And one that can have a big impact is strongyles. There's
Yeah.
large and small strongyles. And the small strongyles, they can encyst in the mucosa of the hindgut. And there are events where they will erupt and have a massive effect on the hindgut. And it's not perfectly understood when or why they erupt, the behavior of those strongyles.
I think it's a bit related to the horse stress, or it can be related to worming. If they've got a large infestation and you worm them, and you get a big death of them as well.
Yes. The encysted ones can be protected too from some wormers as well. So
Yeah.
they can get by without being affected because they're burrowed in a little
So then if
sac
the
that they make.
burnout that affects them and then they all die, then the hindgut's going to be pretty unhappy in that situation.
Yeah.
And the other thing, like when we were talking about posture, and just jumping back for a second because talking about worms made me think about it. So if you're, and we talked about performance and the effect on performance, but if you've got gut pain, you're not going to want to use your core. So, you're not going to want to hold yourself in appropriate self-carriage and posture. You're not going to want to engage your abdominals. You're not going to want to engage your hind end and use that hind end. So I just wanted to relate that back because sometimes they'll have like a bit of a more pendulous abdomen related to dysfunction of the gut. But then you think about, that horse, engaging their abdomen, or you want to put an equiband on them or something, they're probably going to say stuff off. So that aspect of using core and their postural stability is potentially going to be affected there as well.
Absolutely. And if, how would you tell somebody about the treatments that are available for ulcers?
Yeah, so in terms of treatment, like a common recommendation from vets is omeprazole or an omeprazole-like product, which basically inhibits what they call the proton pump, and it reduces the gastric acid production. And by doing that, you're just reducing the irritation of the gastric acid on the ulcer, and then hoping that by reducing the irritation, the ulcer will heal. And I'll talk a little bit about that in a second. The other treatment options are sulcralfate, which is creates like a band-aid on the ulcer, like it's a more protected. I think sulcralfate is now, like Kerry taught us about it when I did his course, but and I was using it a lot in small animals for gut issues, but they weren't using it as much in horses. Like now it's much more utilized in horses. And then ranitidine, which is a H blocker. It's not as effective on stomach ulcers. So often for hindgut ulcers, like sulcralfate and ranitidine are recommended, and then for stomach, omeprazole. But I see a lot going home with like omeprazole and sulcralfate or carafate. So I think that's also a good mixture. The only thing with omeprazole is there have been studies in horses showing that it reduces calcium absorption, and that the ulcers often come back. And so like there was a study that we looked at before that said 90% of horses in one study had a recurrence of stomach ulcers. And this is like one of my little pet hates, right? Is that omeprazole is fine in the acute stages to get your horse comfortable. But at the end of the day, you have to figure out what was the underlying stress that caused your horse to get ulcers, and how do I heal the gut? You know, like how do I build the microbial system? How do I nourish the mucosa? How do I improve my horse's diet? That for me is absolutely integral and not talked enough about by vets when they put them on omeprazole. Like omeprazole is not, that's not it. Like that's not all you need to do.
Yeah.
And in humans, like you can talk about some of the side effects they found in humans related to omeprazole.
Well, in relation to what you were saying about the reduced calcium absorption, there's in humans studies have shown that there's an increased risk of bone fractures, fractures in the hips, the wrists, spine, that you can have nutritional deficiencies from proton pump inhibitors, like a decrease in magnesium, iron, and vitamin B12.
Yeah,
You can
B12 is an important one in horses, like
yeah, and
obviously, and calcium.
yeah, and infections as well. You can have a higher risk of pneumonia, and kidney disease as well. So the body is having to process pharmaceuticals, and you can have acute kidney injuries, chronic injuries, and you can also end up with renal disease. So those were the human-based side effects, and from that, they've done studies and also pulled conclusions about similar things happening in horses.
Yeah. Yeah, so we just need to be really mindful about that. Like, I'm not saying don't use the omeprazole because I think it's really important that you get the horse comfortable, especially if you are continuing to work them, ride them, and they're going to be in a stressful situation, but you need to think about how you're going to manage that horse long term. And so when we talk about like long-term management, like some of the aspects there are especially minimizing stress. Like that's the number one thing.
Definitely. And
Managing stress.
I was just going to add, it's worth noting that in that study we looked at where 90% of horses have a recurrence of ulcers, that was within 20 days of finishing the treatment, finishing a 28-day treatment of omeprazole. So it's a really fast recurrence. It's not something that you treat and then, a handful of months later you think, oh, well, I better make some changes. It's a
Changes at the time, yeah.
Yeah, it's a big deal. And also, omeprazole's bioavailability in the horse decreases by 50% after 28 days of dosing. So to get the
Longer is not necessarily the answer either.
yeah. So there are great things. What are supplements that you tell people about?
Yeah, so as soon as someone tells me their horse has ulcers, I'm like, okay, you need to figure out how you're gonna manage it. So obviously, depending on the severity, like I don't use one particular product, but I have a number of products that I'll recommend, like McDowell's Equigesta Pre, especially once it's under control for management. I find that good for management. The Colado Gastro Aid Recovery, I think it's called, or so I've had really good results with that. In some horses, it has lecithin in it, which has had some studies along with glutamine. Those two products are really, glutamine has been shown, I think in humans, like to help with mucosal healing. And in horses, like they've looked at the lecithin in combination with marine calcium. So digestive EQ can be effective. What else did I have on my list? Aloe vera. I've also had good results with aloe vera, slippery elm bark powder, and marshmallow. And the other aspect is pre and probiotics. So, EAC have a product called Inside Out. I've also seen good results with that, especially when you're suspicious that there's been a flora upset. So if your horse has to go through a stress, then probably sticking them on, some gut protectant like the Equigesta Pre and some Inside Out, to make sure that you're kind of nourishing the gut while they're going through the stress and then prevent the ulcers. Also, like, what about feeding? So, in terms of management from that perspective, because I think that's a key.
Absolutely. I mean, in the ideal world, of course, we talked about the fact that trickle feeding, so horses having access to forage throughout the day with a reduction in the time that they're fasting, is ideal. You know, for the most of a horse's day, they really do need to be taking in small amounts of forage. You that The other thing to note is that it forms what's called a bolus on the top of the gastric juices in the stomach. And so it's like a bolus is a matting of food that is created, and it's created in the mouth as well. That you creates a bolus with the tongue, and it travels down. But you also get this mat of food on the top of the gastric juices, and it soaks up the juices, and it helps with the splashing. So with feeding, right before you go to ride or something, I know I personally will always give a small amount of food. So that's, for me, that's a little bit of lucerne hay. Charlie loves having a little treat before we ride, and it just makes a really big difference going forward, you know, before you are about to transport, before you're about to ride, before you're about to ask them to do things that might swish around that acid in their tummy. Another thing is that the horse's stomach isn't huge. You know, it's not the size of a 10-liter bucket. It's the size of a small football, and it has the ability to stretch and expand, but small and frequent meals are good for the horse. Yeah. What else would you add to that?
Yeah, like if you are doing any changes in feed, like to do it gradually so that the gut flora can cope with the change, especially for the hind gut. And yeah, that's probably all the main stuff. So if you want to know more about ulcers, like I would recommend Dr. Kerry Ridgway's course. Like it gives a comprehensive information. But yeah, from just a general kind of management perspective, if you're buying a new horse, if you have a horse that you're suspicious of, if you have an opportunity, you know, because someone's coming to your area who does scoping, just get them scoped, you know, have a baseline, just know where their stomach is at. And then, yeah, especially like I mean, I basically assume that a horse has ulcers if they've come on a long transport. Like I'll, you know, assume any thoroughbred has ulcers. They're probably both on my high risk. A horse that's just been started, you should have a horse that's going to the breaker on gastric protectants from the start. Like just send them with some sort of gastric protectants. You know, even having monomeprazole during that time could be beneficial. Not ideal because, you know, they're going to have stress and that's going to disrupt the whole digestion, but at least like have them on gut stuff while they're at the breakers, like to prevent and nourish their gut, because that's massively stressful. Yeah, so I just can't reiterate what Sophie said enough about feeding before travel and before riding. You know, my horses have hay in the float. Not everyone is comfortable with that. But if you're not comfortable with that, then make sure they've had a good feed before you put them on the float. I will, yeah, sometimes like Jelly gets fed every time before I ride him little loose and tough feed because of his muscle stuff, but like I'll add a bit of Equigester pre in there, especially if I'm going to a comp or something, to give him that extra protection. Or the other one actually that we didn't have in the management is flaxseed, omega-3s. It's really beneficial for reducing inflammation in the gut as well.
Yeah, absolutely.
Yeah. Anything else?
Definitely. I would just say that it's worth considering the types of feed that you're giving to horses. I mean, with in the hindgut, you have the microbial population that's designed to digest forage. So you can have, like you were saying, you can have a change in the pH that can come from alkaline bacteria that produce alkaline conditions. You can also have bacteria such as lactobacillus that produce lactic acid, and that change in acidity or alkalinity, you know, causes death of certain bacteria, especially the ones you don't want to lose are your fibrolytic bacteria. And one of the reasons for that is because they
and they're not just bacteria, they're microbes, and they're breaking down the
microbes. Yes,
Yep.
absolutely. And just as a small mention, when those fibrolytic bacteria die, they are often gram negative. And so they perfuse over the wall often when it's become thin from being irritated or it's damaged. And so you can have those endotoxins that are in the gram negative bacteria. When they die, they're released. And so it can create a cycle where the horse is, a bit unwell because they're having this endotoxin production, and it's very difficult for the gut to heal without assistance, without a change in management of feed type, the way that we're handling them, and something to reset the system. So just thinking about what you're feeding, is your horse having a huge amount of grains without any forage to break up that grain at the time? Making sure that when you feed the grain that there's forage in it, because as it passes through the gut, you want to be feeding the good bacteria at the same time so that you've got a good balance, as they're eating and producing lactic acid, or they're producing free fatty acids. So just thinking about, what you're feeding as well as how you're feeding it.
Yeah, and really staying away from grains and starches and sugars within the diet. So making sure that your horse has plenty of hay. Even, when the grass is really green and you're like, they don't need the food, I think it's beneficial that they still have hay to try to keep those microbes in the hindgut specifically happy, because the grass often creates quite a lot of acid production at that time. So I think feeding, like making sure they've got low quality hay, low sugar hay, in that time could also be a bit protective. And just don't forget also that chewing produces saliva that buffers the gastric acid too.
Absolutely.
So that's another reason for that forage, is the actual chewing action, and to make sure they're getting hay, not just like loose and chaff is not beneficial in that aspect at all. So
Wonderful.
right. Well, thank you for joining us talking about ulcers today, Dr. Raquel Butler and Sophie Vandenberg. Enjoy your horse time. Please subscribe to the Equine Functional Posture podcast so you don't miss our weekly episodes. And find the links in our socials in the comments in relation to the next Equine Functional Posture course. And thank you.
See you in the next exciting episode.